We have Miss Gladys Moses with us today. Gladys has been a long-time patient in our practice, and what I'd like to do is have Gladys, if you would, Gladys, share with me a little bit about your history with the practice. First of all, tell me, how long have you been coming here, Gladys?
84, since 84.
Since 1980, so about 30 years, huh?
Yes.
And tell me what your problems were and what we've done to help you with your dental problems.
Well, you done a miracle for me.
Really?
You have did so much for me. You're my hero.
Oh, well, you're making my head swell now.
And I would trust you with anything.
Well, thank you so much, Gladys. So, tell me a little bit about your dental situation and what we did for you.
I had gone without dentures, you know, for all those years.
Bottom dentures, right?
Yes, and I couldn't wear dentures.
Uh-huh.
See, I'd go to the dentist and I couldn't wear them, but when I came to Mr. Fish, he did a miracle with me, and he did so much for me, I just can't tell it all.
Okay, so you got a dental implant downstairs, don't you? A big dental implant, and that's what holds your denture in now. Is that correct?
Right.
Well, good. Can you tell me the way you've been treated in my office, because that's really important.
Oh, I've been treated like a queen or something.
Oh, really? Like royalty,
but
huh?
You have good workers. I wouldn't want to go anywhere else.
Well, Gladys, that really, really means a lot. And it really means a lot that you've been loyal to us for 30 years. That means more than I can possibly say. Thank you, Gladys, for sharing this. It'll help me help other people.
You're very welcome, and I would recommend you for anything.
Thank you so much, Gladys. It's a pleasure seeing you. Look forward to seeing you for many more years, okay?
Yes,
right.
I hope so.
Yeah, that's right. Thanks. Hi, everybody. We have one of our favorite patients with us today. This is Reba Barlow. Reba, if you don't mind, I'm just going to ask you a few questions about your treatment here in this office. And first of all, just tell me how you were before you came to see us, what your problems were and how it was affecting you.
Well, my teeth, I've been to the dentist all my life, and my teeth were worn down. And I asked several people in my area who they went to the dentist, and I found out it was Dr. Fish. And my teeth were in such bad shape, I knew that he would do a good job. And since coming here, I've never been treated so kind. Everyone is just so kind and very helpful, and just ask about my needs, and then Dr. Fish has done a wonderful job on my teeth. I'm so proud of it, and when I look in the mirror, I'm not ashamed to look at my teeth like I used to be, and I always notice other people's teeth, and then when I look at mine, I know that I have nice looking teeth too.
Oh,
thanks to Dr. Fish.
Well, thank you so much for your kind words. How were your teeth affecting your life before you came to see us? Were you having like confidence issues and so forth like that?
Yes, I wouldn't kind of open my mouth much to talk, and I had trouble eating. There was it's almost soft foods was about all I could eat because my teeth were so worn down that I needed that.
So refresh me on exactly what kind of stuff we did. We did a couple implants, and what else did we do for you?
Well, I had an upper denture, which I had one, and it was just falling apart, and he replaced that. And then I had 2 implants in the bottom. I had a partial, and those have worked great. My teeth don't move around when I chew or when I talk, and it's such a pleasant feeling.
Oh, well, that's fantastic. Reba, thanks so much for sharing this. It's going to help us help other people, and it's been my pleasure and my privilege working with you. Thanks so much for being here today, and thanks for helping us with this little video.
Thank you.
My pleasure. we have Dolores Troutman with us today, and Dolores has been one of our really good patients, and I just want Dolores, if you would, to answer a few questions for me.
Okay.
First of all, just tell me what kind of situation you were in before you came to see us.
Well, I had dentures, and I had such a problem with the bottom dentures. I could not wear them. They hurt my mouth so bad, and I had them made over twice, and I still couldn't wear them.
How long did you attempt to wear a lower denture? How many years?
I went for about, I guess, a year and a half, and I just could not wear them. And I finally just left them out and said, that's it. And my husband suggests that I come to you. He said that he had, some implants, and said he hadn't had any problems with them.
That's fantastic.
And so when I came to you, I was so surprised. I can't begin to tell you. I had never been to a dentist that was so kind and gentle.
Oh.
You were so gentle.
Well, you flatter me. Thank you so much for your kind words.
I never had any pain, never.
Right. Fantastic.
And that it just surprised me, so I can't quit talking about it.
Well, we love having people talk, the way that you do about our practice, and I appreciate your kind words. So, just tell me what exactly we did for you.
Well, you put in implants.
On the bottom, right?
On the bottom, and then the dentures on top. And I just, like I said, I never felt a thing when you put those in.
Amazing.
And I just can't get over how good my teeth feel. They feel like they've been there forever.
Isn't that amazing?
And I remember you asked me, after you had put my teeth in, after you had finished with me, and you called me to see how I was doing, and you said, I know you probably have to have a little time to get used to them. And I told you, no, I didn't.
Wow.
I was used to them the minute you put them in my mouth.
Isn't that amazing? Yeah, we worked hard to get those right, didn't we?
They are perfect.
Yeah,
perfect.
Yeah.
I can't say enough about that.
I'm very proud of your results, and believe me, it's a privilege to treat you. We've really... I know it hasn't been fun, but it's been just a real honor and privilege treating you. Truly, it has. And Dolores, I think this helps me help other people. And thank you so much for sharing that. And we look forward to seeing you for a lot more years.
Well, you will. There'll never be another dentist but you.
Okay. Well, thank you so much. I appreciate it.
You're quite welcome.
All right.
Thank you.
Thank you. Bye-bye. We have with us today Dee Yoder, who's been my patient for probably, what do you say, the last 100 years or so? What do you think, Dee?
Well, let's not put it quite 100 years, but I have been your patient for over 20 years.
That sounds right. So, Dee, just tell us a little bit about the kind of things you've had done here, and maybe even the way you've been treated here.
Well, I've had extensive dental work done. I've had a few root canals. I've had crowns put on. I've had a permanent bridge installed. And I've never had any problems with any of the work that Dr. Fish has done. My permanent bridge has lasted much longer than he even thought it would last.
More than we imagined.
Exactly. Yeah. And I come twice a year to have my teeth cleaned.
You travel a little ways too, don't you?
I do. I travel from St. Petersburg, Florida, because I feel like Dr. Fish has taken very good care of my teeth, and if it hadn't been for him, I probably would be wearing dentures today.
Yeah, that's possible, isn't it?
It is very possible.
Yeah, well, and Dee, we almost consider you family here, and I hope you feel the same way about us.
I do. I'm very comfortable coming here. Before I came to Dr. Fish, I was afraid of dentists. I didn't want to hurt, and when I come to Dr. Fish, I don't hurt.
Wow.
He makes sure that I don't hurt. And he's, like I said, he has taken very good care of me.
Yeah, and your husband's been coming to see us too for about the same length of time.
About the same length of time, because actually he started before I did, and his teeth are in perfect condition. He has had some dental problems, gum problems, and he sees Dr. Fish twice a year, and he's doing extremely well now. He's eliminated most of his problems.
Well, Dee, I am so flattered that you continue to come see us, even all the way from Florida. That makes us feel great. And you know, Dee, thank you for doing this. It helps us help other people. And thanks for your vote of confidence after all these years. It's been a real privilege and a pleasure working with you.
It's been my pleasure, really, because you just don't realize how bad my teeth were and how afraid I was to come to get them fixed. I really was very afraid, and I have a very low tolerance for pain.
Right.
And being pain-free and being able to get my teeth worked on and corrected has meant everything to me.
It's been a life changer, hasn't it?
It really has.
Great. Well, thanks so much, Dee, and we look forward to seeing you for a lot more years, okay?
I hope you'll be around for a lot more years.
I have to. I got three daughters, so I'm going to have my belly up to the chair for quite a while. All right. Thanks, Dee.
You're welcome.
We have one of our favorite patients with us today. This is Debbie Suick. Debbie's been my patient here for how long has it been, Debbie?
Close to 5 years.
It's been 5 years?
Yes.
Boy, time flies, doesn't it?
Yes, it does.
Debbie, would you share with me and whoever might be viewing this how you were when you first came to see us, dentally?
Dentally, I was a mess.
Right.
I mean, truthfully, I had a partial on the top of my mouth. The teeth were falling out that were holding in the partial. It was just an overall disaster.
Okay. Now, were you fearful of the dentist at that time? I can't remember. Or were you pretty okay about dentistry?
No, I was fearful. I had had some bad experiences. So my dental appointments were very few and far between because of that.
Right. Yeah, you kind of avoided it, didn't you? Like a lot of people.
Yeah.
So tell me about how, first of all, how you were treated here and how you are now.
Well, the treatment here is beyond anything I could have imagined, really.
Thank you.
Everyone here is wonderful. No one is judgmental here. Everyone just treats you like your family. And from my first appointment that I was here and had my consultation, I felt so welcome and felt that I was in great hands with what was going to be done to me.
Oh, well, that really means a lot. Thank you for sharing that. Tell me about how you are dentally now. What kind of things have we done, and how are you functioning? Just things like that.
Dentally, I'm doing great. I am doing great. I come every 4 months, have my teeth cleaned. I'm not afraid to do that anymore.
That's great.
And I'm just, I can enjoy food now that I never could before. I've had implants done that have been great. I'm just overall very, very happy.
Wow. Well, that makes my day. Thank you so much for sharing that with us, Debbie.
My pleasure. Anytime.
All right. Thanks. Yeah, we have Pat Stroop with us this morning. Pat has had some significant dental work in our office, and I just would like you, Pat, to just tell us how you were before. I mean, how were you when you first came to see us?
My teeth, I had gone to another dentist in Hickory, and I have gum disease. And when I walked out of there, my teeth were notched, and they were just, over the years, they had started turning. And so Dr. Fish took my turning notched teeth, and he gave me this.
Wow, that's fantastic. I think I'm going to try to zoom on that a little bit. Can I zoom on you? Yeah, wow, that looks fantastic. So in other words, you were very unhappy with the way things looked and the way things were going with your teeth.
Yes.
And you were able to make some significant changes here. Is that right?
Right. And I had a bridge that after I had had the periodontal work done, the bridge was just hanging down.
It was too long, wasn't it? Yeah.
And so now I have a new bridge.
Well, that's
and
great.
I have new caps, and I have new veneers.
That's great. So tell me before I leave you, tell me how you were treated in this office, because people want to know how they can expect to be treated.
I felt like I was the #1 person in here.
Well, of course you were.
I would come in on Fridays, which Dr. Fish doesn't usually open on Fridays, but he would give me a half a day.
Oh, now the secret's out, Pat. I'm joking around.
To give me, to get this done as quickly as possible. And it was virtually pain-free.
Fantastic.
And if I had it to do again, I would do it again, and I would recommend it to anybody else that talked to me, because the outcome is fabulous.
Well, Pat, that means so much to us. Thank you so much. You know, words like yours will help us help other people, and it's a great pleasure. It's a privilege having you in my office. Look forward to seeing you for a lot more years.
You will, and it's been my pleasure.
Thank you, Pat. We have today with us Ms. Carolyn Setzer. Carolyn's been a patient in my practice. How long has it been now? Do you remember?
Came for the initial visit in November of 2010.
So just under a year.
Yes.
Okay. Tell me a little bit, Carolyn, about how you were when you came in here initially.
Initially, I'd been through different dentists, surgeons, was under a lot of stress mentally, just trying to find the correct procedure that needed to be done to my teeth.
Right.
And when I met you, it was such a relief to meet someone that actually gave me resolution.
Right. Had a little bit of confidence about what was going on.
Correct. I felt like I was being piecemealed, going from dentist to surgeon to dentist to surgeon. And came to you and felt like a weight had been lifted off.
Oh, fantastic. So tell me a little bit about how your teeth were when you first came here.
Had several old fillings, root canals that maybe had been aggravated, old crowns, dental work, 10, 15 years old. And
you had some teeth that were actually broken off.
Been told I needed implants, maybe bridges, this or that, but nobody could actually tell me what I needed to have done.
Right, right. And just, okay, so tell me, first of all, how you were treated here and what kind of things we did for you.
Came here, you looked at me, you treated me like I was just not some kind of crazy person with like, oh, well, she just needs this or that. You looked at me, said, well, let's just do the right thing. You took me each section of my mouth and said, okay, we're going to do this, 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 and just made me feel like that you could resolve the problem, not just make it okay for a couple months and then we'll go to do this.
Right, so you feel like you got some good long-term solutions in
exactly
there. And I think we probably do. I really hope that we do.
Yes.
I think we do.
Because you didn't want, because you could have told me that I needed 10 implants and I would have said, okay, fine, because I was to the point that I was going to do whatever. But then when you told me that was overkill, that you were going to do what was best for me long-term, because not just having 1 or 2 teeth, I had 10 maybe teeth that needed to be worked on.
Right, right. All back teeth, right?
Correct.
Yeah, and just tell me a little bit about how you are now.
Oh, great. I feel like I have just got a new mouth.
Yeah, so the teeth feel comfortable and normal and can chew.
I can chew, no sensitivity. I'm not afraid to eat. I was really afraid to eat on one side, then I'd eat on the other side because I was afraid, okay, what am I going to be doing now? I feel confident. I can smile now. I feel like I have a new mouth.
That's great. It's changed your life, hasn't it?
Correct. It has.
Well, that's really great. I really appreciate you taking the time to talk to me today, Carolyn. And thanks for sitting down and doing this interview. And it really helps us help other people.
Yeah, you've been great. I would recommend you to anybody.
Thank you so much. That means that makes my day. Appreciate that a lot. Thank you, Carolyn.
At Abernathy.
Oh, well, great. We appreciate that. We have Martha Tibbs with us today, and I'm just going to ask you a couple questions, Martha, and get you to explain the kind of things we did for you here. So just tell me a little bit how you were before we started treating you.
I really didn't like to smile much because I had a partial. You was always afraid it might drop.
Right.
And it's just wonderful to be able to smile and go and have surgery without having to take your teeth out.
That's right. That would be pretty embarrassing, wouldn't it?
Yes.
Yeah.
And that's wonderful to me.
Good.
It helps you a lot that way.
Yeah, it helps your self-esteem, your self-confidence, doesn't it?
And I was able to, while I was even in intensive care, I was able to floss. I took the picks, with me, and I was able to do my flossing and brushing when I would eat, and it's just wonderful to be able to smile and
they look gorgeous. So tell me a little bit about the kind of things we did for you here and how you were treated here. Can you help me with that?
Everybody is wonderful.
Oh, well, thank you.
Everyone is wonderful. They're friendly, and they try to make you feel good about yourself, and
great.
It's just really a nice place to come.
And you had several implants done. Do you remember how many?
5 on top and 3 on the bottom, I believe.
And then we filled in a lot of the other areas with just crowns and bridge work and things like that.
Crowns and bridge work, and you removed one tooth that you were worried about maybe lasting because it had been ground down, built up, and crowned.
Right.
And so you put in a 1-tooth bridge there for me.
Right. So you in other words, you've got 2 full arches of teeth now that don't come out. Is that how it is?
My teeth does not come out.
Right. You've got 2 full arches of fixed teeth that don't come out. No partials, no nothing.
No partials. And it's wonderful.
So it was well worth it for you.
It was worth it.
Okay. Well, that's great, Martha. I really appreciate you coming in today, and thanks for sharing. This will help us help other people. Thanks so much.
Thank you.
All right. We have with us today Ruth Long. Ruth's been my patient for a couple years now, and we did some implants on Ruth. Ruth was having some difficulties. I'm going to let you explain it, Ruth. Tell me what kind of problems you were having and what we did for you and how you were treated, and I'll let you tell your story. Go ahead.
I was on probably my 4th or 5th set of dentures, and I've had dentures for probably 30 years, but after a period of time they just get loose fitting, and they're not comfortable, and I was just ready to give up. I didn't think there would be a set of dentures that would ever fit my mouth until I came up here. The thing about coming up here, I kept putting off my needs and taking care of my children's needs, college and all that.
Yeah.
And finally I thought, I'm going to do it. I wish I had done this 30 years ago. I mean, this is amazing, the difference it's made in my life. I enjoy eating, as you can tell, and I get to eat more, and I get to eat it faster.
Good for you. That's great.
But the pain and discomfort, and also, I hate to be vain about it, but the looks are so much better, too. I get so many comments on my teeth. I don't care where I'm at, I'm willing to talk about my teeth with anyone. I'm that proud of this set of teeth.
That's fantastic. So tell me a little bit how you were treated by my staff and me in this office.
This staff is like family. I've always been afraid to go to the dentist because as a child I wasn't treated very nicely by dentists.
Right, that's common.
And I put this off, I put it off, and I wish, like I told you, I wish I had come here earlier.
Yeah.
It's just the atmosphere here, everybody treats you like family, good family, and they're just so nice and cordial and willing to help in any way.
Oh, well, that's really fantastic. I really appreciate your kind words, and it's been a real pleasure working with you too, Ruth. I hope to see you for a lot more years.
I hope so too.
Good. All right. Great. Thanks, Ruth.
Thank you for even seeing me and bringing me this far.
No problem. Glad to do it. Bye-bye.
Bye.
Okay, we have Robin Newman with us today. Robin, if you would, just tell me how you were before you came to see me.
Well, I couldn't even wear my lower dentures when I had my teeth pulled out. And I couldn't chew certain things, eat the things I liked. And I would swallow my food too not chewing it up well, and that messed up my digestive system and everything. Okay. So, but as far as my facial features, they were too.
What was different about your facial features?
My mouth started sinking in on the sides where I was not wearing my lower teeth.
How long were you not able to wear a bottom denture?
At least 10 years.
10 years, wow. Okay, well, can you tell me a little bit about how you were treated here and what kind of things we did for you here?
Everything was wonderful.
Great. Thank you, thank you.
And the outcome is wonderful. But I brought in, and I was nervous at first, but everything just passed by so great, smooth, and everything I wanted I got and more.
Oh, fantastic! I love hearing that. That's great. So we did some implants on you. Is basically what happened. And just tell me a little bit about what kind of work we did in your mouth, just in case people are curious.
I put 4 full implants in, and then made the dentures. You know,
the snap-in denture.
Snap-in dentures, and changed the coloring for me. They was more whiter teeth. And
smile for me real big. I want to see. Oh wow, it looks awesome.
And I love it. Everybody loves it. It's such a big difference.
Yeah.
I feel so much better about myself.
Yeah, it's a big confidence builder, isn't it? Yeah. A lot of our patients tell us that. Well, that's great. Well, it sounds like it's a real success story, and I really appreciate you sharing that with us. Anything else you need to say?
No, I just want to thank you so much.
Well, it's been a privilege working with you, Robin. Honestly, it has. We love having nice people like you come to see us, and thank you for being such a great patient.
Thank you.
All right. Thanks. Okay, we're rolling. So I'm here today with Chuck Hubbard. It's been my patient for a number of years. I just want to ask you a few questions. And first of all, Chuck, just tell me how you were when you first came to see me.
My teeth were virtually gone. I had had struggles with poor teeth for a couple of decades, and I had to have the last of the teeth removed. So basically I had nothing. You had nothing,
huh? Okay. And if you would, just tell me a little bit about how you were treated here, how we took care of you here.
Actually, I felt like the treatment here was perhaps the best I've ever had in a doctor's office. Throughout my life, very kind, very courteous, and very interested in my progress.
Good. And just, if you would, just share a little bit about what the kind of things we did for you.
Well, I mean, just keeping me comfortable, keeping me informed, letting me know the process, and being available for me when I had questions, and you know, I just felt very informed, and I felt very certain about the process.
Okay, and if you would share with me a little bit about the actual dental procedures we did for you.
Well, first off, there was the removal of what teeth were left, and then the process of mapping out the surgery that was going to be done, you know, and then there was the day of the implants, the initial implant procedure, and that went well, you know, minimum of discomfort.
So we did a net of how many implants? Do you recall? I've kind of forgotten.
I'm thinking in the neighborhood of 12 or something like that.
Yeah, your whole lower arch is implant support, and I think you've got 2 implants upstairs.
That's
is that correct?
So it's 10 or 12, I guess.
So you've got on the bottom, you've got teeth that don't come out. They're pretty much as close to real teeth as we could possibly give you. Is that kind of what your perception is?
That's correct. It works perfectly, and at the top, it's a denture that is placed in with 2 locators and 2 implants, and it has functioned quite well. I mean, it's made a world of difference to me.
Well, just tell me a little bit about how it's changed your life. You mentioned earlier it's changed your life. Just tell me a little bit more, if you would, about that.
Well, imagine walking through life and not being able to smile.
Right.
Not wanting to deliver that part of myself to another person.
Right.
The smile. That's to begin with, and of course there are a lot of foods you can't eat when you have bad teeth. And,
right.
You know, I have no limits there. You know, and I can smile whenever I want to.
So you can chew and enjoy your food way better than you imagined, huh?
Oh, it's like having my own set of teeth back. You know,
that's fantastic.
It's been a wonderful experience.
Okay, well that's great, Chuck. I really appreciate you sharing that with us, and I hopefully that will help us help other people.
Well,
and thanks for coming in today, Chuck. Appreciate you a lot.
Thank you.
All right, thank you.
Okay.
Hello, Stan. We have Stan Yu on with us. Hey, Stan, just tell us a little bit about how you were when you first came to see us.
Oh boy, what a transformation. I had neglected my teeth for so many years and my gums, and it was just in terrible shape when I came to see Dr. Fish, and I'm so glad that he was able to restore my mouth and my dental condition.
What were your teeth like, and how long had you been without care?
About 25 years.
No kidding, wow.
And then finally I came because I fractured, as Dr. Fish remembers, 2 teeth. And so there was no choice but to come.
Right.
And I'm so glad that I did.
Yeah, but you got a little bit more than you bargained for. We ended up fixing your whole mouth, didn't we?
Yes, I needed the whole mouth fixed.
Yeah, so tell us a little bit about how you were treated here, how we cared for you and what we did.
Oh, not only is Dr. Fish an extremely skilled and implant specialist, but his whole team has been so helpful, and it was all virtually painless. And that initial work, which was under general anesthesia, was completely without pain and discomfort.
Fantastic. That's great. So how are you now? Tell me how it's changed your life. What's it done for you?
It's just been incredible, a transformation. And I can chew, I can talk, and without any problems at all.
And you can smile a lot with a lot more confidence,
true.
can't you, Stan?
Yep.
Yeah.
That's quite true.
Well, that's great. Well, Stan, thanks so much for sharing that with us, and we look forward to seeing you for a lot more years, at least till you're 100, okay?
All right.
All right, great, Stan. Okay, great. Thanks, Stan. All right, bye-bye. We have Florence Arney with us today. Florence, could you share with me a little bit about how you were before you first came to see me?
I was in pretty bad shape. Having a lot of problems.
What kind of problems?
I had lower partial and couldn't live with them. And see, I tried and I couldn't. My mouth would get so sore, I'd have to take them out. So when I took them out, I had holes, you'd call it, when I smiled, you know, when the filling.
The teeth were gone, right?
And I had teeth that had been capped. The caps had were falling off. And I already had them replaced once, and then they were getting loose again. And I decided I had to do something.
You were in a bad way, weren't you?
Yes, I was.
So, yeah, so can you just tell us a little bit about how you were treated here and what kind of things you had done with us?
I probably sound like I'm overdoing it, but I can't say enough how well I was treated here.
Appreciate that.
I had, you know, it takes a little surgery to get implants. I went through it with flying colors, didn't worry about it. I actually looked forward to the next procedure because it got me a little closer to where we were going. And
exactly.
I just came through it with flying colors. I can't say enough about how well I got along at this office with you, Dr. Fish.
That's great. And how are you now? Tell me a little bit about your results.
My results is wonderful. If I don't know if I mentioned or not, I didn't smile before. If I did, my hand went up to hide my mouth. And since then, I just throw that smile at anybody, anytime, all the time, without even thinking about it.
Well, that's a great story, Florence. Thanks so much for sharing that with us.
You're certainly welcome.
We appreciate you a lot.
Yeah, I recommend you to everybody. If
Thanks.
they start talking about, I need to have this done, you got to go get a better dentist than Dr. Fish.
Well, I sure appreciate that.
I just, all your newsletters, how you keep up with everything, it's amazing to me.
Well,
that you, one person, keeps up as much as you do.
Yeah, well, we sure try.
You stay on top of it, really.
Yeah, well, great. Thank you so much, Florence. It's always a pleasure seeing you. All right, thanks.
Nice
Bye-bye.
seeing you.
Okay, Gary, first of all, thanks for coming in today. I want you to tell me a little bit about how you were before you came in here, before you came to see me.
Okay, well, I had a lot of problems with my teeth. Obviously, I wouldn't have been here.
What kind of problems?
Mostly, my caps would keep coming off. The teeth that I had in the front would come out. My feelings were always, if I'd floss them out. I just had a bad bite, bad teeth.
Yeah, you were going downhill pretty fast, weren't you, Gary?
Yes, I was.
Okay.
And I just got to where I had to have something done. My teeth was wore out on the bottom. My teeth in the top would not stay in half the time.
Right.
So I needed something to be done.
Okay, well, tell me a little bit about what you had done here, how you were treated here, and what kind of things we did for you.
Okay, I was treated well. I was pleased.
Good.
And I am a little bit of a picky person, but I have been completely satisfied.
Fantastic.
With the outcome.
That's great. And we did some implants. What else did we do?
Yes, you did 6 implants. You capped every one of my bottom teeth. You changed my bite.
We opened it up, didn't we?
Yes, you did.
Yeah.
And you made my teeth where I can use.
Yeah, it was a complete overhaul, wasn't it, Gary?
Yes, it was.
Okay, well, good. Well, I'm glad you're doing well, Gary. We love treating nice people like you, and I hope you'll send all your friends and family to us. We'll roll out the red carpet for anybody you send, I promise.
Okay, I appreciate the work.
Yeah, we appreciate you, Gary. Thanks a lot. We have with us today one of our very favorite patients. This is Jerry Heltzer. She's going to talk to us a little bit about the kind of experience she's had here in my office. Jerry, how were you before you came to see me here?
I was having a lot of difficulty with my bite and with my teeth in general, some which had been repaired before, but that was wearing down. So I just needed a good overall looking at and repair work done on my teeth.
And it seems to me, didn't you have a failing implant or something?
I certainly did. I had an implant which had become loose in the bone. In fact, I had 2. And I was really frustrated because I didn't know if anything could be done about that.
You didn't really know where to go. You just needed somebody to solve your problems, right?
I did. I had a lot of problems to be solved, and I was glad to find you, Dr. Fish, and get it worked out.
Well, great. So tell me how you were treated when you were here in my office.
I was certainly put at ease. I came in pretty frustrated and nervous, but I was put at ease right away. And Dr. Fish talked to me in terms I could understand. So did all of the staff. And when I was told what could be done, I felt very good and comfortable about coming back and starting quite a long process.
Yeah, it was quite a big deal, wasn't it?
To be done, yes it was. And work that I didn't think could be done, and some work I didn't even realize how badly I needed.
Right, well good. So how have the results been? Tell us a little bit about how you're doing now.
I'm doing great. I can eat very well on both sides of my mouth. I have had absolutely no problems with any of the work that was done. And I feel better when I smile, when I talk, when I eat, when I chew. I just feel good all
around about the way my mouth works for me now.
That's great news. Well, thank you for sharing that, Jerry. That's really about all I need. I just want to. I'm glad to be able to record your thoughts so we can help me help other people.
Well, it's been wonderful for me. Thank you for what you did for me.
Great. Thanks, Jerry. Thanks so much.